Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Stephanie Baker, a physical therapist at Bradley Whiteside Rehabilitation. Stephanie has been a physical therapist for over 12 years. She started her career in a hospital setting where she gained extensive experience with heart, oncology, and stroke patients. For the past 3 years, she has worked with lymphedema patients. Bradley Whiteside Rehabilitation Center is located at 1225 Broderick Drive in Dalton, Georgia, next to Bradley Wellness Center. Stephanie, thank you for joining us today.
Thank you for having me. I'm so glad to be here.
It's going to be fun. Going to be fun. Stephanie, can you tell our listeners exactly what lymphedema is?
Yes. So lymphedema is an increase in prolonged swelling. Lymphedema can typically occur in an arm or a leg, but it could also happen to be in your head or your neck or other parts of your body.
Right.
One of the most common causes that we see in lymphedema is a surgical procedure, such as a removal of lymph nodes with cancer treatment, or could happen with radiation, but it could also happen with trauma to an area of the body. We can also note that it could be hereditary, right? That we could see that you could be born with it.
Well, Stephanie, is this something that, like, let's just say after surgery, it stays swollen? It doesn't, the swelling doesn't go down like you would expect it to?
So what we see, especially with cancer treatment, right? Where we've had lymph nodes removed.
Right.
The swelling doesn't always happen right after surgery. It could happen years down the road. So that's why we believe that it's important to be able to educate, especially our oncology patients, because we want them to be aware of what they need to look out for so they feel prepared if they start to see swelling, that they need to speak with their doctor about it.
Now, you mentioned trauma before, like if you're in an accident or something happens to you, it can happen years later then too?
Sometimes. It's been dependent with each patient, but sometimes we may see that they may take a fall and hit their arm or their leg, and they may notice a little bit of swelling right away, and that doesn't go away, or it can stay and hang around for a while.
And this is sometimes, not all the time, but sometimes hereditary, something that could be in your family history?
Or sometimes you can just be born without some of those lymphatic vessels that help to move your fluid in your body. But typically we notice that earlier on, soon after you're born, or maybe when you're a teenager or a young adult.
Well, how is this treated? How do you treat this?
So currently there's no cure for lymphedema, but we always want to note that it can be treated with therapy.
Okay.
Here at Bradley Whiteside Rehabilitation, we have 2 certified lymphedema therapists, both a physical therapist and a physical therapist assistant. We both have undergone extensive training and education so that we can provide the best care to you if you do indeed have lymphedema or a concern for lymphedema. And this treatment can vary between patients. Your specific needs would be determined after a skilled evaluation by your therapist. Commonly, your treatment plan can include an intensive phase and then a maintenance phase. For the intensive phase, patients will undergo treatment including lymphatic massage, or what we call manual lymphatic drainage. And all that means is that we're doing a certain type of very light massage that helps to move fluid in the affected body part. It can also include compression bandages, which help to reduce the size of the limb or the body part affected.
So what we're trying to do is reduce this swelling.
Exactly. After this intensive phase is completed, next we have the maintenance phase. And that's where you're going to be measured for compression garments that are specifically fit to you that help keep the swelling from returning. And these garments could be like a sleeve or a glove that someone would wear on their arm, or it might be knee-high socks or thigh-high stockings. And these garments are very important to wear and to continue to wear to help keep the swelling from returning. They're a very important part of lymphedema therapy.
Are they uncomfortable?
No, that's why it's important for you to be measured by someone that's extensively educated, because we're going to make sure that we order garments that are specifically fit to your size. We include multiple variables that will help make sure that we know that we're getting what you need. And most of the time people have said they may have ordered compression garments just from off the shelf, and they didn't find that comfortable. But then after they come and get treated over at Bradley Whiteside Rehab, and we find the right compression garment for you, it's so much more comfortable, and then they can stay consistent with wearing it every day like they need to.
And is that a prescription that you write?
Yes, if we need to get a prescription from your doctor, especially if insurance will cover it, but we take care of helping to order that, and then we would educate you on if it was appropriate for you to order them in the future too. I think it's important to note too that we refer to this as a maintenance phase because it's lifelong. Lymphedema is a lifelong diagnosis, and it needs continuous monitoring to make sure we're being aware of any change in symptoms, or if you may need a different garment, or if your garment isn't working for you particularly. And you can come back and see the therapist at Bradley Whiteside Rehab, and we can help problem solve that and help come up with a better solution for you.
Sounds good. A lot of listeners right now, some may be thinking maybe they have lymphedema. What is the next step for them?
Definitely. So the first step, if you have swelling that you're concerned about, would be to speak with your doctor, because we know that swelling can also be caused by congestive heart failure or kidney disease, blood clots in an arm or your leg, or even skin infections. It's important to get these causes ruled out first. A vascular doctor can help determine if you may have swelling due to issues with your veins, so they would be good to talk to. After you've spoken with your doctor and have been cleared, you just ask them for an order to come to Lymphedema at Bradley Whiteside Rehab, and we'll get you scheduled for an appointment.
Is there anything that Bradley Whiteside Rehabilitation has to offer to help those listening now?
I think it's important to note that if you are a breast cancer survivor and you have undergone surgery to remove any lymph nodes, or if you've had radiation therapy, we want you to know that you can be at risk to develop lymphedema in the side that was treated. And like we talked about earlier, this can happen immediately after surgery, or it can develop years down the road. That's why we say to everyone that's undergone these procedures that you're in a latent stage or even stage 0 lymphedema. We can help teach you what you can be looking for with signs of oncoming lymphedema, as well as how you could work to prevent it or treat it very early on if you do start to develop swelling. We'll take measurements of your arm, even when you don't have any swelling, because if you do ever start to see any of that swelling, we can compare it to those baseline measurements and treat it immediately. Ideally, we'd really love to see breast cancer patients prior to their surgery for true baseline measurements and be able to have that time to educate them on what they can be doing to help with their range of motion, with strengthening their muscles, and prevention of lymphedema. But even if you are a few months or a year or even years out from treatment, or even currently undergoing treatment, we found that so many women and men have benefited from coming for physical therapy because it helped improve their muscular tightness and their strength so that they could do more of what they enjoy without pain. It's also given those patients confidence to know what they can safely do for exercise and how they can progress. And I always love to say that movement is medicine, and addressing your movement can, and in my opinion, should be a vital part of your recovery.
Well, Stephanie, thank you so much. It was great to meet you. Thanks for coming in and talking about this.
Thank you for having me.
It was wonderful. I appreciate you taking time to join us here on the show, and it's always good to see you. You're welcome back anytime.
Thanks.
For more information on Bradley Whiteside Rehabilitation, visit hamiltonhealth.com/rehab or call 706-272-6199, 706-272-6199. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.